very good afternoon to all of you. I am Dr. Rupali. I am the clinical coordinator at the Assisted Reproduction Unit at Indraprastha Apollo Hospitals, New Delhi. So today I am here to talk about a very important and a very pertinent topic, actually affecting almost millions of people all across the globe. And the incidence is rising as we talk. It is crazy. So I'm going to be talking about how not to get infertility, how to prevent infertility as a couple, as being planning a baby, how actually any steps which you can take to prevent infertility from occurring. Yes. So there are various factors which I would like that the people around me are educated about. They have this understanding. One is that infertility is more of a scary condition than it actually is, number one. Number two, there is a specific time period which has been advised by the World Health Organization before a couple is labeled infertile. A 3 months of regular unprotected intercourse, or even a 6 months of regular unprotected intercourse without any specific reason would not mean infertility. You will not be labeled as infertile. Under good circumstances, in a healthy couple with a healthy relationship, at least 1 year of regular unprotected intercourse is needed, is what is required before a couple is labeled as infertile, unless and until you have some pre-existing cause. The female partner has some causes, or the male partner has some causes. And today I'm here to talk about those causes, at least the preventable ones. Not everything is preventable, I will admit to that, but at least being in the current era where I can talk to you online, where we can communicate through such easy medium like a online portal where you're just sitting at your home, you can listen to it. I would really want to educate you. One of the most important things when we talk about it is the age of the female partner. Internationally, all across the world, the correct age of the female partner helps us to prevent infertility. Now, I have people who are 42 years of age, who are 45 years of age, and they want babies. Especially if you talk of the female partner. What to do? You can't do much in such cases. You can't give them a baby with their own eggs. The fertility capacity of the eggs does exhaust. Right? There is a specific age. You can't have your own eggs being utilized for having a baby after a certain age. Menopausal women cannot have babies of their own eggs. Yes, you take a donor egg, do an IVF, have a baby, not an issue. But your own eggs, no, a big no. You end up wasting a lot of money. Success rate is very poor. So, one important point which I want to put across to my audience here is that age of the female partner is very, very important. Indeed, internationally, the age is 35 years. So if we say 35 years, after 35 years, even the success rate of the infertility procedures, of all the world famous, whatever we have available, the entire spectrum, that goes down markedly. Right? Not many studies have been done, as I have told in my previous talks as well. There is one study where Indian women were compared with Spanish women, the European women, Spanish women. And they said that Indian women were at a disadvantage by 6 years, which is huge. You tell a person you get married, have babies at 29, no. Nobody wants to do that. But they do not realize that the clock starts ticking. If you want your own biological babies, there is a right time to do it. That is why the concept of egg freezing came into being. That is, that eggs of young females who are career oriented, yes, why not? Why should they be left behind? It's a career oriented world. The men are racing. Why should the women be left behind? Indeed, it's the new term in gender equality now that yes, you have a certain age, you have certain limitations. Get your eggs frozen. It's being offered as a perk for some, international companies like Google, Facebook, etc. across the world. They give it as a perk to their female employees. That's one thing which I really wanted to stress upon. Second is one male, one female, so alternate. We can also pick up some questions if we have something I do not know right now. But yes, so talking of males, one of the most important factors which we are really coming across is alcohol intake. The alcohol intake, the smoking, history of smoking cigarettes, or even, yes, the newer fad is, newer fancy is taking shisha. So with shisha, one shisha is equivalent to 200 cigarettes. If I say that the smoke of a cigarette can decrease the motility of the sperms, the moving capacity, the movement capacity of the sperms, which is very important for a normal pregnancy, that should be avoided, right? So, alcohol, cigarette smoking, all forms of smoking like shisha, electronic cigarettes as well, for that matter of fact, they are detrimental for the male partner to maintain a good fertile sperm. Now, going over to the next factor, yes. How else can we prevent it? So, one of the reasons why patients end up in our clinics being infertile is they've had multiple infections. When you talk of genital tract infections, that is the reproductive tract infections, the problem with such infections is that many times they're less symptomatic. The patient would have probably just a little bit of discharge, small pain, took some pill at home. That's what Indians do, just pop a pill, and at the end of the day, you're happy, you're asymptomatic, you're happy. But that's not the right way to go about it. Infections of the reproductive tract, of the genital tract, should ideally be treated. It will be wiser to go to a gynecologist, get them treated, rather than having a problem in the end where you end up in having infertility, where you end up in having, your tubes going in for a sex where you have to go for an IVF. So one very, very important message here again is that please get your infections treated by a proper treatment rather than just taking the pill at home so that you don't end up in having infertility later. Alright. So next is the turn of the male partner. Yes, one very important cause which is causing infertility is the body building drugs, especially the steroids, which are, nowadays men really want to look macho with their muscles, with their six packs and all, and most of them do take these steroid injections into, especially for bodybuilding, etc. I would really like to warn them then and there, and stop them, because I have myself seen patients come to me with poor sperm functions, no sperms in their semen, etc. Now, that is something where they can intervene, they can control that part, take care that they do not take unnecessary steroid injections. You don't need it, rather than ending up in infertility, which becomes almost like a permanent thing also. Initially, it will be reversible in the initial phases, but no, it becomes irreversible as well. So, and I feel the general population, the people around us, even the educated ones, are not aware of this. I think it is my duty, it is our duty being doctors to tell them that yes, this needs to be treated, and it is like something which can be prevented. So people who are very over excessive enthusiastic about the gym, more so taking steroids, not gym per se. Being fit is very important. I don't deny that. Doing your regular exercise is a good practice, no wonder, no doubt about it. Please go ahead. But having said that, taking steroid injections for building your muscles, for building your body, for those looks, it's not acceptable. So now switching over to the female part. Yes. When we talk of female part, one of the commonest causes of infertility is PCOS, or Polycystic Ovarian Syndrome. Now, this is a disease of the affluent society. We are all affluent. We belong to Delhi, to developing India. Such amazing food is available everywhere, and whatever the health, the lifestyle factors, I would not pinpoint and say, because that's prevalent all across our part of India now. So when we talk of polycystic ovarian syndrome, yes, it's one syndrome where the weight gain becomes very high. The propensity to gain weight becomes quite high in the patient. And once that occurs, once the propensity of weight gain occurs, then subsequently, even the problems of ovulation, that is the formation, the egg formation, also really increases the chances that they have an ovulation problems. That is, they will have problems with egg formation becomes much higher. It actually is a vicious cycle. Once the weight increases, the problem increases. Other than that, you do have other features which I think, like hair growth, etc., which I will not be talking about in detail much right now, maybe in the subsequent talks. But these things really lead to infertility. And as a person who is affected with it, as a patient, or whose family member is affected with it, where can you put a break? You can't put a break on the ovulation part, because that's what is happening internally. You can only put a break on the part of cutting your weight down. That's the place where you can intervene, break the cycle. If it's a cycle, that cycle has to be broken, then only things will improve. And let me tell you very, very clearly, you do not have, one person does not have to go all the way to a normal weight. If we have a patient, I have had patients who were, say, 110 kgs, 100 kgs, and they got down by just 10%, 15% of their weight. The chances of fertility really improved, and we had excellent results in such patients. Their pregnancy was much more healthier. The person actually needed 40 kgs to go down to a normal bracket of body mass index. But even if she lost, say, 15 kgs, those cases, 10, 15 kgs, a 15% loss, 15 kgs, 20 kgs, we were able to get her to resume her fertility and have a baby. That too, the baby was born healthy, which is most of them. So, having said that, these are very, very important points, that a person needs a healthy lifestyle. Says no to all forms of drugs, even for the female partner, not only for the male partner. Alcohol, drugs, and smoking are very, very detrimental. Yes, eating healthy vegetables, eating diet rich in antioxidants is what is needed. A colorful plate is what my dietitian gives. A colorful plate with all colored vegetables, green, red, yellow, all possible colors in your plate is one way of improving your vitamin intake, improving your nutritional status, improving your diet, which is rich in antioxidants. Stuff like green tea, they say, does improve, although nothing, although it's not completely proven to be of dosage to be of benefit, but yes, antioxidants, taking nuts, taking almonds, flax seeds, etc., also improves the fertility. So I would like to just conclude that yes, taking a healthy diet, living a good lifestyle, more specifically weight loss, avoiding, avoiding intake of alcohol, cigarettes, or steroid injections for bodybuilding, taking a timely treatment of infections, be it due to tuberculosis, due to non-tubercular discharges which occur in women, is very, very important. If they are taken on time, then the chances of anybody getting infertility will not be there. Generally, you can prevent infertility by these scenarios. Do we have some questions? I can't see anything. So we have a question from Malvika Singh saying that her age is 35 and AMH is 1.66. क्या मैं naturally बिल्कुल conceive कर सकती हूँ, इसमें कोई doubt नहीं है. I always tell my patients that normal conceive करने का अगर आपकी ट्यूब्स खुली है, अगर सिर्फ एक AMH का प्रॉब्लम है, तो आप बिल्कुल सोचिए मत, स्ट्रेस की कोशिश करिए. This one AMH which has come in the market has created havoc amongst people. But all said and done, AMH is not the only test. We have to understand this fact. AMH is not the only test. 1.66 is a slightly low AMH, but it does not mean that you need an infertility treatment if you've not tried well enough. Okay, so make sure that you're trying properly. Maybe you can take an assistance of an ultrasound maximum to time your intercourse, but otherwise, please do not think that you cannot conceive naturally, right? So it's completely fine if you want to try. So AMH, yes. So the next question says that my friend has had 2 failed IUIs. The AMH is 1.02, and her doctor has told her an IVF option with donor eggs. So AMH alone is not indicative of donor eggs, is what I would say. I would say that एक basic ultrasound जो होता है second third day पे, इससे हमें number of eggs पता चलते हैं. That along with AMH, along with the total patient profile, should be evaluated. Going for IVF with donor eggs may be a later on option depending upon the age. What is the age of your patient, this patient which you've written? So if she has had failed 2 IUIs and her AMH is 1.02, which is borderline low, which is a little low, it is not completely low to say no IVF with your own eggs. Indeed, we tried for with this AMH, I would also not say that it's completely big no for not natural conception. Sometimes even natural conception भी हो जाता है. So please do not get depressed. If you're very adamant, it is definitely advisable to go for one cycle with your own eggs also. You can go for one cycle with your own eggs. AMH is not the bottom line completely. Yes, it will help us to prognosticate the patient. But looking at the type of eggs, the number of eggs on an ultrasound will give us more clue as to it. So yes, the next question is 30-year-old, 2 embryos transferred, got positive in 4 weeks now. My HCG is 1200. I have PCOS. A bit worried about miscarriage. What should I do? So I'm sure your gynecologist your IVF specialist has given you a lot of injections, a lot of treatment. When we do IVF, especially in our country, we tend to over-treat the return. And when you talk of PCOS, there is a definitively increased risk of abortions. But when you're doing an IVF and we are giving you injections when we transfer in the post-transfer phase, injections along with all forms of medications, the oral medication, the vaginal medication really tends to bring down the chances of miscarriage. Although it does not completely go away, it will be there to a certain extent. But whatever treatment is possible from our side, I'm sure your gynecologist, your IVF specialist has done that. So don't worry. From your side, from her side, she would have given you treatment. I'm sure about it. Don't worry. Especially if you do an IVF, it's not a natural conception. In natural conception, we might not give you too much of a treatment. But in IVF conceptions, we over-treat you so that we don't leave any stone unturned for at least for a chance of miscarriage. That way. Do we have more questions? Thank you.